Hi, you guys. Have you ever had pain that seemed to improve, like you treated it and you thought you had taken care of it, and then a short while later you get pain somewhere else? Like your neck finally feels better and now your jaw is giving you heck? Or your low back pain eases, but now it's kind of in your side and it's traveling down your leg, or your shoulder was really giving you a hard time and now all of a sudden it's in your mid back between your shoulder blades? And it makes you start wondering, like, is my body falling apart, or is something more seriously wrong, or am I just getting old? Why doesn't this just stay fixed? What if pain actually isn't spreading, but your nervous system is relocating it and it's giving you information that it wants you to pay attention to? Today, I want to talk about why symptoms move, why pain shifts locations in the body, and how to stop chasing body parts and symptoms and start understanding the protective pattern that lies underneath it, because the body is totally not random. It's adaptive and it makes sense, but you have to understand the language it's speaking. I'm Dr. Melanie Carlo, and welcome back to Why It Hurts and How to Heal. I've been a physical therapist for over 40 years with a master's and a doctorate in physical therapy, kind of a fool for punishment, but that's another story. I'm also a yoga instructor. I've been practicing yoga myself since 1993, and I have 2 certifications since 2000. I've been teaching yoga, breath work, pranayama, and I love nervous system education. I work with people who live with chronic pain and who have kind of been train wrecks of the system. Like, the system has not served them. Their inflammation, their fatigue, the chronic bracing, kind of the nervous system overload is pretty much the population that I work with. And those people who feel like they've tried everything and they still don't feel like they can get to stability in their body. Well, it's pretty remarkable what can happen when you start to internally understand what's actually going on. So today I want to unpack something that most providers, healthcare workers, just never explain. A lot of them may not even know it because we're so siloed in our thinking. When pain improves in one place and then it shows up somewhere else, there's a reason. So let's go deeper. In the clinic, I see it all the time. Someone treats their neck pain, they stretch, they strengthen, they get massage, they think, okay, I got that. They mobilize it, it all works for a while. And then a week later, or a month later, now their jaw hurts, or their shoulder, or their low back, and they think, oh, wow, now something else is wrong. What is up with me? But here's the distinction. Local relief is not the same thing as nervous system regulation. When you treat one area, you might decrease the mechanical load in that area, but if the overall stress pattern in the nervous system is still active, the system just learns to redistribute that tension to another place in the body, because it's always ever trying to help you, and its job is protection. It's not comfort, it's not ease, it's protection. So we got to learn to work with it. And the real question becomes, if the pain isn't random, okay, I get that, but what pattern is organizing it? So let's talk about how the body manages load through these kind of reflex pathways, these primitive nervous system loops. Because your nervous system, the primitive nervous system, has been organized to help ensure your survival through reflex loops, okay? Methods of bracing in the body. Animals know how to shake it off and be done with it, but we never really learned that. So let's think about different reflexes. So there's the green light reflex, and this is kind of the bracing, arching, overdoing in the back of the body. And this is where you see patterns that lie in myofascial meridians. Tom Meyer's book, Anatomy Trains, really goes into this in a beautiful way. But when you see the back of the body, these lines of fascial muscular movement getting tense, and the body tenses in the back, that's the green light reflex. The red light reflex is more the collapsing reflex. This is the deep inner line. If you take all the intestines out, this is the musculature that lies in the jaw, the front of the neck, goes right down through the front of the body, under the rib cage, into the belly, the hips, all the way down into your shins. And so when this musculature has been prompted to be on alert mode, it causes collapse, fatigue, front body guarding. Maybe you've seen people at the grocery store who do a lot of bending and leaning over grocery carts. That's an uncontrolled red light reflex. And then there's a trauma reflex, named because there was a trauma in your arm or you broke your leg. Like I fractured my leg, my tibia, fibula, and dislocated my foot when I was 15. And I still have patterns that want to show up in the body. So you get these rotational or asymmetrical protective patterns. And they're not diagnoses, they're survival strategies. They're ways that the body works in order to help you, except it's not helpful anymore. And that's what we work with. So, for example, if your upper traps and your shoulders have been bracing for years and they finally can't hold that much load anymore, it begins to affect the neck and the jaw. And then when the jaw fatigues, the mid-back stiffens. And if the thoracic spine and that mid-back locks down, now the lumbar spine tends to get compressed. And it's not dysfunction, it's like load management. The body isn't actually malfunctioning, it's doing what it does well. It's redistributing stress along these familiar pathways. So then you got to ask, well, what's keeping this turned on? And more importantly, how do I turn it off? So pain relocation often happens when the overall system's kind of under a high load, when there's cumulative stress across multiple systems. You know, I often say to people, if you have a roof that's got leaks in a whole bunch of areas, you don't plug one leak and go, well, that didn't work, and take out the plug and put a plug in another area. You have to actually look at all the elements that drive breakdown and stress in the body. So there's hormonal stress. This is what we call HPA axis shifts. There's inflammatory load, where you're taking in foods or you're in environments with a lot of chemical cleaning solutions, or you're putting, you know, these beauty products, which are really unregulated, on your body, and all of these chemical smells are actually going in and dysregulating, driving inflammation. You could be under emotional stress. Your sleep is disruptive. Really important piece of bringing us back to balance every day. Or there's just too much going on cognitively and you feel overwhelmed. Unresolved tension in relationships. All of this drives the nervous system to be on high alert. And the nervous system doesn't separate physical stress from emotional stress. It's all stress. It could be an argument, a deadline, a memory, or subtle feeling of, you know, not being safe, having that feeling again, or not being seen. And the body responds in real time now, often calling on patterns it developed back then. And if one structure in the body under tension has already released, like that protective threshold, can't take much anymore, then it just moves it right down the line. It chooses a different structure to carry the stress the next time. So this is why I often hear people say, I didn't even do anything. I don't even know what caused it. So I often ask that question. It just came on all by itself. Why is it hurting there now? Then I start to think about these multiple system overloads. So how do we help the nervous system to drop into safety? How do we get it to understand that internal environment in which safety can occur and the load can drop? So let's talk about interoception, internal awareness, like perception, interoception. Your body's ability to sense what's going on inside me. When the nervous system's been under chronic stress, the interoception can become distorted. Like the signals you get might be too loud or they could be dull. You're just not getting good information. And what used to just feel like tightness now just actually feels like pain. And when you treat one area and quiet it down, another area that was already bracing all of a sudden pops into view. And it's not new damage. It's you perceiving greater load. So instead of asking, what can I do about where it hurts? Start thinking about, how is my nervous system organizing stress, and what can I do? So I want to bring in some simple whole system resets. Sometimes they're so simple you think, I don't know if that's really going to work, but just try it. Experience this directly. And it's not about fixing you. It's not about being broken. It's about creating a conversation with the nervous system in its own language. All right? So you can stop anytime and feel free to do so. But right now I want you to just tune into your physical body. Okay, I've been doing a lot of want. Just let your breath come into your awareness now. Feel the body breathing. And orient to where you're at. Let your eyes be open and slowly move around the room. Let your eyes move before your head. And just notice, just name color. Gold curtains, pale walls, sleeping chihuahua, white desk. Just move your eyes around the room and let your head follow. Okay, and this is a way of tuning in interoceptively to the body. Now breathe into the low back ribs, and I want you to lengthen the exhale. A really simple way of educating the nervous system is to lengthen the exhale. It tells your primitive brain, I'm not in high alert mode. I don't need to mobilize to run away. I'm here, and I'm safe enough. So, letting your eyes move, your head, just noticing, and breathe into the low back ribs. Maybe you bring your hands around to your back and feel them push apart and back. And just notice already the difference that it makes. Try this when you feel times of stress. It is amazing. All right. So we're starting to tell the primitive reflex brain, I'm right here. And now I want you to begin to gently rock your pelvis forward and back, small movement. And let your pelvis go first, and then your mid-back, your upper back, your head. And let your pelvis go first, your mid-back, your upper back, and your head. So almost like a wave. And as you do this, notice your jaw and your shoulders. Does it shift? Does it begin to feel a little less stressful? All right, and so now if it feels okay, we're going to spiral. So sit bones grounded. I want you to turn your belly button to the right, and then your belly, and then your heart, and then your head, and then your neck. Turning to the right. You can put your hand on your hip and give it a gentle pressure. And then go ahead and let your head turn back, your shoulders turn back, your mid-back, your belly, and come back. And now let's reverse and go to the other side. So no forcing, just exploring rotation with awareness. And you can notice the environment. Turn your belly, your mid-back, your chest, your head, your eyes. And now let your eyes come back to center. Let your head follow. Let your chest follow. Let your belly follow. And go ahead and repeat on the other side. Rotating again. Let your eyes go, your head, your body. Let yourself experience the rotational flow. Maybe first you move at the belly, and then you move at the neck, and you start to explore rotation. Just notice what happens exploring rotation. If you have old patterns of one side tension, you're going to notice one side moves easier than another. Just notice. Don't try to fix it. Pain relocation often happens in areas that have lost rotation, lost variability. So be very kind. Okay? Now, one hand on your chest, one on your belly. Inhale through the sides and the back ribs. Exhale slowly through the mouth. And as you exhale, I want you to gently sway side to side. And notice if one side feels easier, one side feels heavier. Just notice you're not correcting. You're restoring conversation. And take one more slow breath and then just pause. And what do you notice? Did anything subtly shift? Is there a pattern to your pain that you've noticed over the years? Maybe it's the back, the neck, and the jaw. Or maybe it's one-sided in your shoulder and your hip, or the other side. Go ahead and throw some comments in the text below. Let me know what you think. Mapping reduces fear. When you start to pay attention to it, the pattern makes sense and the body feels less unpredictable. So if this kind of nervous system literacy was resonating with you, you are welcome to subscribe. Please do it, because I want to talk about this every week. And let's go one layer deeper, okay? So when you chase symptoms, you focus on location, but when you're building nervous system awareness, you focus on your overall state. So symptoms may say, my hip is really the problem, but your nervous system awareness asks, am I bracing all the time? Pulling back, or am I collapsed? Is my tension asymmetrical and overloaded? When you start to pay attention to your inner state, your interoception increases, symptoms begin to stabilize. You bring awareness. Not because you forced it, but because the nervous system no longer needs to redistribute to protect you. And regulating it doesn't feel like collapse or bracing. It doesn't feel like you're trying to relax. It feels like breath, deep breath, long, slow out breath, or the jaw resting without clenching, or the shoulders settling without forcing, the pelvis responsive. It all begins to kind of quietly organize. We live in a culture that treats our bodies like machines. It treats everything like objects. If something hurts, just tighten it, or work it out, or stretch it, or inject it, or fix it, or give it a pill. But your body is not a machine. It's a system of relationships. Muscles are in relationship to your organs. Ligaments are in relationship to your bones. Breath is in relationship to your emotions. Emotions have everything to do with posture, and posture relates to memory. So when we approach healing through relationships, we move from trying to dominate and fix to actually pausing to listen, and from force to coherence, from isolated bits and pieces to integrated patterns. So that whole need to relocate the pain, when you bring your awareness to it, starts to decrease naturally, because your system doesn't have to shout to get your attention. So if your pain keeps moving, just know it doesn't mean you're broken. It doesn't mean you missed something. It means the nervous system is doing its brilliant job of managing load the only way it knows how. And your work isn't to chase the next thing. It's to build enough safety so your system no longer has to redistribute that protection. So learn to regulate before you try to renovate yourself, or soften before you strive for that next thing. Compassionate listening is profound. So if this episode helped you see your pain differently, please like it and subscribe. It helps me keep the information coming. And comment what shifted for you. I pay attention to it. And the next time we'll go into something even deeper. What if pain isn't exactly the problem, but it's a messenger? Safety first, change second. You are not broken. You are learning to protect in the way your body's designed. Thank you, guys. It's great being here with you. See you next time.